announced that he was starting some type of program through executive order, and yet little on the details. Can you shed some more light on this?
Can shed light on the fact that 49 out of the 50 states before yesterday had what we would call a prescription monitoring program,
right,
that would track prescriptions for certain drugs of abuse. And certainly one of the biggest problems we have now from an abuse problem is opioids. So these are the Oxycontins and the heavy narcotics and the painkillers.
Right. Legalized medical grade heroin.
Probably more potent than heroin in some respects, how they're reformulated. So if people get a hold of these pills and kind of reformulate them and make them very, very, very potent and potentially deadly.
Right.
So the monitoring program starts looking at, well, where are the prescriptions coming from, and is there an increased frequency, so we can try to get a handle on cutting this back and curbing this.
Mm-hmm.
And it's scary. I think over the past few days, just watching the media, the New York Times published a story from an ex-wife whose ex-husband was a very powerful patent lawyer in Silicon Valley, completely addicted to these things and ended up overdosing, and he killed himself. I think last night I saw a story of a little boy who just came in contact with one of these drugs, and the contact was enough for him to absorb the drug, and he ended up dying.
There was a police officer a couple weeks ago that had needed like 3 or 4 shots of Narcan to survive a dusting of fentanyl.
Right. Yeah. So that's what I mean by the very, very powerful and very, very scary stuff.
Yeah.
Clearly way more scary and powerful than drugs of the past.
Yeah.
I guess the other thing is the Narcan thing. So there's been some debate nationally about Narcan. Heard one county in the state of Ohio, which is apparently the hardest hit with this epidemic across the country. The sheriff said he's not in favor of putting Narcan in his cruisers or having his troops trained with it, because he thinks that is going to increase folks' use of opioids and heroin. And
well, it's a price. It's expensive, this Narcan. And some people are having it 2, 3, 4 times a week, not in Ohio, but right here in St. Louis. They're overdosing, and we're just sending them right back out onto the street to do it all over again.
Mm-hmm. Well, that's the other part of the program. So we can monitor the prescription drugs and try to cut that back. But there are some legitimate uses for these types of medications. So I think you want to be very careful in terms of trying to keep away medications that some people are going to need. You can think about people with serious pain disorders, especially late stages of cancer, and they're just completely in pain. And these are the only types of drugs that really work for them. We wouldn't really want to deprive them of those because some people are abusing them. Narcan is an expensive medication. It falls in line with those other things that we've talked about. Technically, not very many companies make these, and so they can charge the price based on what the demand is.
Right.
And so it costs a lot of money. It's very short-acting. It's not a cure. It just reverses the effects of the medication so that it potentially can, in a short period of time, protect somebody from dying.
Yeah.
But it doesn't stop anything else as you're talking about.
And I know that lawmaker or that sheriff was criticized for saying that. But and I don't know where this ends, the medical segment and the political segment, but there's something inhumane about giving you a drug that will instantaneously revive you and then send you back out on the street to do it again so I can revive you 2 days from now or later tonight. And so at some point, when does society say, this Narcan is saving your life to go do more terrible things down the line? There's a better way to solve this problem.
I guess for fair and equal balance, I could phrase it differently. If 1 out of, pick your number, of people potentially is saved because they receive Narcan, and they seek help and are able to get treatment, and they can get off these things. And so then they're not falling into the line of what you're talking about. So let's say it's out of 25 people that might get this, 1 might turn themselves around.
Right.
Is that a worthwhile equation? Would be a different way of asking the question. As when we can't save everybody, we can't and our society definitely isn't structured to force people to follow this line or follow that line. We're terrible at that.
Right.
But it is a societal problem, and it's not. This is just the latest in many, many things that we've.
But we've had heroin addicts on the show say when they send out alerts, right, from the media, from the police, say, hey, there's a bad batch of heroin going around, be careful. Where you or I say, oh my goodness, that's terrible, the heroin addict says, that's great, let's try and find it.
Right, because it's more potent.
Right.
I get a bigger high.
Right, so
Absolutely.
So there's no way to solve the problem when these people are looking for that edge.
It is a societal problem. And, the whole thing that's going on this week about the health care bill, the unsaid things, because we just get into that silly finger pointing thing in Washington D.C. about, well, these guys are bad and these guys are bad, but the amount of money that they're potentially going to allocate or not allocate to this kind of problem across the country is really chump change, because it's a serious problem. People have addictions and have issues and have problems that need help, and those things cost money, and it's a societal cost. We have to decide whether we're okay to bear that. We've taken care of and dealt with things like alcoholism. We've dealt with other drug abuse issues. We've formed things, as old as the Betty Ford Center that has been around for a long, long, long time, and many prominent people have gone to. These things are ubiquitous, and anybody can fall into this realm.
It seems like, though, for the drunk who can't get himself, can't help himself, or the addict, or the cocaine addict, or the crack addict, and as bad as that is, it seems like the heroin addict, it's harder and more difficult. And so they need some medical assistance to get off it. But the medical community, there's no, if somebody breaks their arm, you talk to 10 doctors have the same advice to fix the arm. In this instance, you get 10 doctors in a room, they'll tell you 10 different ways to solve the addiction.
Correct, because I think a big piece of the addiction is the mental aspect that's driving the person to be addicted.
Right.
And treating mental issues and psychiatric disorders is highly problematic. We don't know as much as we'd love to know of how things happen inside this brain of ours, how these connections form, and these things are serious cravings. And so it starts from, and the reason why heroin's so bad is it goes so quickly from an experiment to completely hooked. There's no middle ground. There's no middle ground. And you think about how many things you potentially experimented with, whether it's a cigarette or a beer or whatever, there is a human ability to kind of potentially say, well, yeah, this was good, but maybe this isn't the best thing for me. I don't think that exists in heroin.
Right. Well, right. I was a smoker, and I was broke, and I would go through the cushions looking for nickels and dimes. I wouldn't beat anybody up. I wouldn't kill someone. I wouldn't leave my child in squalor to go find a cigarette. But that's what you're seeing normal people do when it comes to heroin.
Right. Absolutely.
Yeah.
So it's bad, and I think it's money, it's effort, but I think it's the bigger push needs to really come from society. So I applaud the governor for doing what he did.
Right.
But I do not believe that we should be heralding this as something great. When we're behind.
Right.
When you're the 50th state out of 50, we're not leading the way for sure. Right. So I think there's a lot more we can do to catch up and to help our folks.
I'm out of time, but where are you when somebody says, you know what, maybe the best way to solve this problem is to legalize it, get them some type of safe heroin, get them in a secured place so they don't overdose, so they're not beating up old ladies, they're not breaking into banks and doing terrible things to those around them. Watch them, control them, and try and give them help that way.
It sounds like a great theory, but I can point to, I guess, numerous numbers of things where we've either legalized or non-legalized things that necessarily haven't worked out that great. I think a lot of ingenious and imaginative things need to be tried here. because if you project forward over the next 5 years, it doesn't look pretty. And this is only a problem that's going to get worse.
188 murders in the city of St. Louis, but they revived over 700 people from a heroin overdose in the city.
Yes.
And look at how much attention goes into crime, and look at how little attention goes into this problem.
I think that's the point.
Yeah.
So I agree completely.
Dr. Michael Lim, cardiologist with SLU Care and SSM Health, St. Louis University Hospital. Great stuff as always. Thanks.
Thanks, guys.